You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
Okay. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks. That's great. I'm sure I'll have lots more questions at our next meeting.
You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come on in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. I think it's called the medial meniscus.
Mm-hmm.
Is that right?
Mm-hmm.
It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis. So he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right. The problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it. So I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affected my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms, and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. The weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last. You hear a consultant endocrinologist talking to a patient called Sarah CROFT. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
OK. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
OK, well, I've had high blood pressure for several years, but these last few months, that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other problems recently.
Yeah, as you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, oh dear, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing. And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, you know, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore. I often feel tired, though. In fact, like really tired.
And what about your skin?
Oh, yeah. It seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
OK, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
It must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, 1 minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves. And I can't seem to concentrate like I used to. You know, I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do 1 or 2 more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
Okay, I see. And how long will everything take, I mean, before we know what's causing the problems?
Well, I'm afraid it can all take some time, as diagnosis can be quite complicated, and we may need to take...
You hear an anaesthetist talking to a patient called Mary Wilcox prior to an operation. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mrs. Wilcox, you tell me you've had high blood pressure. So, are you taking any medications for that?
Yes, a blue one and a white one.
And do you know the names of the tablets?
Yes, so one's thiazide.
Okay.
And the other one's lisinopril.
Perfect. Thank you. That's very helpful. And have you had them this morning?
Yes, that's what the nurse told me at the pre-assessment, yes. So is that all right? Just with some water? I usually have them before breakfast, but she said no food at all this morning.
Excellent. And apart from the high blood pressure, do you have any other medical problems at all?
Yes, I take some blood-thinning drugs because I had a small heart attack a bit ago. So I'm taking aspirin. And at the pre-assessment, they said to keep on with them. So I had one this morning, like I usually do. They told me to stop the other one. I can't remember the name.
Warfarin?
No, it begins with C. Clopidogrel. They told me to stop it a week before the operation, 7 days.
Fantastic.
So I stopped last Tuesday.
Great. Now, tell me a bit more about this heart attack. How long ago was that?
2 years ago, my GP picked up on it.
Did that all go...
Yes, pretty good.
And why did you go to your GP? Were you having chest pains?
They weren't chest pains. They were... I was just getting a bit breathless, and it was difficult for me to tell what was going on, but Dr. Scott picked up on it when I went to see him, and he sent me to the cardiology team.
Right. Did they say you'd had a heart attack?
Yes, they told me I'd had a small one, and so I had some stents put in, a couple of them.
And since they were done...
Yes, I've been better. You know, I don't feel so tired all the time.
Okay. And what can you do in terms of exercising?
Well, I can do anything. Anything, really.
Tell me what you can do.
Well, we have stairs at home, and we don't have a loo on the ground floor. It's on the first floor. So I'm up and down a few times a day.
And walking on the flats, fine?
Yes, that's okay.
Any problems with your ankles swelling?
Well, this one, it swells up if I've been standing. I had my veins done, my varicose veins, but the other one's all right. I sprained it quite badly last year, but it's fine now.
Right. Can I just ask you a few other questions about your heart?
Sure.
Have you ever had any palpitations at all when your heart goes bum bum bum?
No.
You've never experienced any of those?
Well, no, not really. I mean, if I run, my heart beats a bit faster, but that's normal, isn't it?
Sure. Anything else? Any digestive problems?
No. Well, if I have a heavy meal late at night, like if I have a pastry or something, I sometimes wake up in the night feeling a bit like heartburn. But if I take an antacid, it's fine.
Right. So in general, you sound to be in pretty good shape. Now, in a minute, I'll tell you about exactly what type of anaesthesia we'll be using. But first of all, is there anything you'd like to ask me? Do you have any concerns about anything?
Well, I suppose the main thing is after the operation, when I wake up. I mean, will I be in a lot of pain when I come round?
No, you'll be given morphine during the procedure, and that will still be working when you wake up. And then, when that wears off, you'll be given something else. There'll be someone keeping an eye on you.
Okay. Oh, the other thing is, I've heard that if you have crowns in your mouth, they can get damaged if they put in an air tube.
Well, it's unlikely, but we'll take special care. So, which teeth are we talking about?
These two.
Okay, the two central incisors. And do you have any other teeth with crowns or implants?
No.
Okay. So, what we have planned for you is...
You hear a pulmonologist talking to a patient called Robert Miller. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Miller. Now, looking at your notes, I see you've been having a few problems recently. Could you tell me a little about what's been happening in your own words?
Well, yeah, it's a combination of things, really. To kick off, I feel pretty tired most of the time. Just haven't got the energy I used to have.
Right.
And I've got this cough. It's there all the time, and it feels dry. I mean, I'm not coughing up phlegm or blood or anything like that. But the worst thing, which really bothers me, is that I'm so short of breath. Even if I'm just getting dressed in the morning or going up a few steps, I have to stop because I get breathless so quickly. And I've lost quite a bit of weight, too. I mean, I didn't notice at first because it was very gradual, but all in all, I'm about 10 kilos lighter than I was 6 months ago.
Right.
I've not been dieting or anything. I love my food.
Okay. And, well, have you noticed anything else?
Yeah, just take a look at my fingers. The tips look swollen, don't they? And it's the same with my toes, which are bulging out at the end, too. It's weird. And my nails, I don't understand it. They've become soft. They're not hard like they used to be. Look.
Okay, I see what you mean. And tell me a little about yourself. What you do for a living?
Well, till recently, I worked as a farm laborer. Did it for about 20 years in total. It was hard, physical graft, and it finally got to the stage where I just couldn't cope with it anymore.
Right.
It really took it out of me. So this last couple of years, I've been a security guard, working nights at a local DIY warehouse. It's a bit boring, and the late shifts took a bit of getting used to, but it's okay.
And are you finding it less physically demanding?
That's right. I just haven't got the stamina now for anything else. In fact, I've even had to give up my golf. Can't manage it anymore. Any spare time now goes on looking after my pigeons. I've done that since I was a teenager.
Oh, very nice. And what about your medical history? Now, I see you were diagnosed with hypertension last year, and you're taking beta blockers at the moment for that.
That's right. My GP said it'd help. Something the GP also said when I saw him about my breathing problems was that he heard what he called crackling noises in my chest.
Okay.
I can't hear them, but he could through the stethoscope.
Okay. And is there any family history of breathing or lung problems or any serious illnesses that you know of?
I don't think so. My mother was always healthy, but my dad developed bad eczema as an adult. I remember the red patches on his hands and face, but he didn't have any lung problems as far as I know.
Right. And, well, looking at your previous tests, you were diagnosed with hypertension about 6 months ago. You had...
Oh, yeah, an echocardiogram, to check my heart.
Yes.
And a chest x-ray about 4 weeks ago after I saw my GP. That came back okay, as far as I know.
I see.
I'm not keen on hospitals, to be honest. Am I going to need to have lots more tests?
Well, I'm going to suggest you have what's called an arterial blood gas test. This will let us check how well your lungs are working, how they move oxygen into your blood and remove carbon dioxide from it.
Okay.
And I'm also going to order a CT scan. Now, this will be more revealing than the chest x-ray you had. And I may then prescribe a course of corticosteroids. This will depend on what the tests show up. Now, I'd start you on a relatively low dose, and then we'll see how...
You hear an eye specialist talking to a patient called Jasmine Burton, who has recently undergone eye surgery. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
I've got your notes here, Mrs. Burton, but as we're meeting for the first time, could you begin by telling me a little about your eyesight and the treatment you've had over the years? Did you wear glasses as a child, for example?
Yes, since I was about 7.
And my parents were concerned by the way I held a book when I was reading, so they took me to an optometrist. He told them I had some kind of astigmatism.
Am I right in assuming that's myopic rather than hyperopic?
Well, yes, I'm nearsighted, if that's what you mean.
That's right. Some people actually have mixed astigmatism. They're farsighted in one eye and near in the other.
Oh, well, that's not me.
Right.
And as well as my astigmatism, as you probably noticed, my eyes flicker. I'm not aware of it myself, but other people comment on it sometimes. I think you call it nystagmus. It meant that when I had my eye surgery, they preferred to use a general rather than a local anaesthetic.
OK, so did anyone ever tell you what they thought might have caused the condition?
Well, I was once told that my generally poor eyesight is most probably down to the fact that I don't have enough pigment in my eye.
Right.
On the whole, my eyes have never really caused me any significant difficulties, however. I've always had to wear glasses, so that's part of life now. I suppose the only thing is that driving's always been out of the question. I'd never have passed the sight part of the test. That's probably a good thing because it takes me some time to focus, which could make me pretty dangerous if I was ever behind the wheel of a car.
Yes, indeed.
Also, I'm useless at sports like tennis. I think that's because I'm poor at judging the distance between myself and the ball. That was a pain as a teenager, but I've never particularly wanted to play since then. And I've hardly had any issues at work because of my sight. I'm a receptionist in a hotel, and I've never had any difficulty reading computer screens or anything, fortunately.
You've had your eyes regularly checked throughout your life, presumably.
Yeah, that's right, every couple of years. My prescription has changed a little over time, but not that much. Though I certainly couldn't manage without reading glasses these days. About 3 years ago, I was told a cataract was developing in my right eye.
Right.
It was a few years before they decided to remove it. That was this February. And it all went very smoothly.
Good. And you were pleased with the result?
Yeah, I was. Yeah, thrilled. If only all our failing parts could be replaced so easily. However, when I had the routine checkup a couple of weeks after the operation, I was told there was some clouding, opacity.
Opacity, yeah.
I think was the word they used, in the capsule containing the new lens. It's a bit disappointing. They could clear it with a laser if it gets to be a real problem, but my flicker makes that rather a risky option. I knew that there's a greater chance of developing a detached retina after a cataract op.
Yes.
But I'm glad to say they found there wasn't any evidence of that in my case.
Oh, good.
All they did was make an appointment for me to be checked out again in 6 months' time. But they said I should get in touch if I felt concerned about my eyes.
And is that what brings you here today?
Yeah, because I am bothered about a couple of things. So firstly, I've noticed more floaters than usual.
Right.
I don't know if that's something to worry about or not. More annoying is the fact that I'm much more troubled by glare than I used to be. So I wanted to ask your opinion on that.
OK, well, let's start.